Hello everyone. In this video, we'll be discussing about the role of a nurse in admission and discharge of a mentally ill patient. So now, let me share the slide. So first, let us see what is admission. So admission in simple meaning, it means it's the entry of a patient to a hospital or a ward for therapeutic and diagnostic purpose. Or you can also say admission is allowing a patient to stay in hospital for observation, investigation, treatment, and care. Admission of a patient, especially a mentally ill patient, in a hospital can be broadly categorized as voluntary on and involuntary. Voluntary admission means where the patient is aware about his illness and is willingly or voluntarily coming to hospital and tries to get a treatment. However, involuntary is a situation where the patient is having poor or absence of insight. That means patient is not aware about his illness and therefore he's not willing to voluntarily come and admit or take up the treatment. So knowing this type of admission, you will understand the kind of patient, how the way they behave or the nature of the patient. Often voluntary patients, as you know, because they willingly come to hospital, they are often very cooperative to take the treatment. However, involuntary, the patients are incooperative and often difficult to handle. So knowing these differences, you should be able to take care of the patient's needs. Now let us see what is the role of a nurse in admission procedure. So first of all is to introduce self. So a most important feature of admission procedure involves settling the patient in the ward. So this begins by introducing yourself to the patient and introducing the patient to other staff members and patients. This will make the patient feel more comfortable and secure. Next is meeting the biological and emotional needs of the patient. So before assigning the patient's bed, you must also consider the patient's biological and emotional needs. For example, if the patient seems highly suicidal or having suicidal ideation, or the patient must be acutely psychotic, in this situation, remember you're supposed to place the patient in a place where he can be closely observed. So, for example, you may choose a room which is before the nurse's station so that observation is easier. Orientation of the ward. The patient should be shown about various facilities available in the ward or the hospital, such as the eating room, the recreation room, bathroom facilities, etc., so that the patient can utilize all those facilities. Acquaint with ward rules and routines. It is also important for you as a nurse to explain all the ward rules and routines to the patient who are admitted in the hospital, such as the meal timing, the ward activities, visiting hours, how to make appointments to see staff or any healthcare professional members, timing for any group timing, etc., so that he can follow the routines and the policies of the hospital. Giving support to patient's family member. Remember that patient as well as his relatives are most likely to have all sorts of anxiety about various procedures and investigations that might be done on the patient. Therefore, you as a nurse must be very sensitive to these needs of the patient or to the feelings of this patient and give them enough time, attention, and allow them to express their feelings about the patient's condition, treatment, and outcome. So therefore, as a nurse, clarifying the doubts of the patient and family members is very important and giving them all appropriate informations. Now we'll see the patient's right. So it is also important for you as a psychiatric nurse to protect the patient's right. Therefore, you should know some of the rights of the patients. So here are some of the rights of the patient: the right to wear his own clothing, the right to have individual storage for their private use, the right to keep their the right to keep and use their own personal possessions, the right to spend a sum of their money for their own expense, the right to have reasonable access to all communication media like telephone, letter writing, and mailing, the right to see visitors every day, the right to see the right to treatment in the least restricted settings, the right to hold civil service status, the right to refuse electroconvulsive therapy, and the right to manage and dispose of property and execute wills. Yes, these are some of the rights, although there are many other rights which are available in books. So, nursing implication in protecting the rights of the patient involves, first of all, is to protect the patient's right. You as a nurse, you're supposed to know the right of the patient at the first place. Next is to ensure that the ward procedures and policies does not violate the patient's right. It's also your responsibility. Next, including these rights in nursing care. So it is important for you as a nurse to discuss all these rights with the mental health team members or the healthcare members, and including these rights in nursing care plan is all part of your responsibility in protecting the patient's right. What is parole? So parole is a permission given to a patient to perform certain rituals or attend certain family functions, or a simple meaning, it's a release of a patient on a trial basis. So parole happen, it can also happen just before the admission of the patient, just to see if the patient can adapt and behave in the society or in a community or environment in which the patient is supposed to be seen. So it's just a trial basis to see how the patients behave. Now, what is your role of the nurse in parole? First and foremost is to give clear instruction about the purpose and the time to bring the patient. So relatives as well as the patient has to be clearly instructed about the purpose of why you are sending this patient, and also a clear instruction to the relative as to when you have to bring back the patient. Next is a written consent from the relative. So, as a nurse, it's very important before you send the patient for parole, you're supposed to take a written consent from the relative, stating clearly as to why you are sending the patient for parole and for how long and when the relative is supposed to bring back the patient. You may also have to fill the parole form. Again, this depends according to the hospital policy. So, if the hospital has the parole form, you must fill the parole form before sending the patient. Next is medications. So when you send the patient for parole with a relative, you as a nurse must also make sure that you give all the necessary medications to the relative so that they can administer or give the medication to the patient whenever needed. So here explaining the relative about the medication, mainly the timing, the frequency and dosage of the medication is very, very important. Then instruct a relative how to converse and behave with the patient. So instructing the relatives as to how they should converse or behave with a mentally ill is very important, especially according to instruction which is given by the doctor. Remember that mentally ill persons sometimes can be really difficult in handling them, and most of all because the relatives are not a professional person who would be able to handle the patients, and therefore it is important for you to clearly tell the relative or the person in charge of the patient to how to they have to communicate and behave with the patient. Next we'll see discharge. So what is discharge? Discharging of a patient from the hospital means relieving a patient from the hospital setting who is admitted as inpatient in that hospital. So your role or responsibilities as a nurse in discharge includes ensuring that the patient leaves with his belongings and personal effects. So you as a nurse make sure that the patient leaves the unit with all the belongings and personal things, and also has appropriate medicines with the patient so that he can take it once he is back at home, and has appointment for follow-up. Okay, this has to be taken and make the patient understand as to when they're supposed to come back for a follow-up. A clear instructions. So all necessary instructions should be given, especially regarding the patient's medication regimen. Okay, you must explain about the medication, mainly the frequency, the dosage, the timing as to when they're supposed to take the medicines, and also a little bit about the side effects of the medications. Okay, so this education should be given both for patient and family members. When you especially about the side effects, this is because the family members, the relative or the patient can identify those effects on them and notify to the healthcare members or the doctor. So all this instruction must be clearly given to the patient and his family members. Next is documentation. Remember, documentation is a legal document, and therefore it is very important to complete all the paperwork and documentations on time. That includes the patient's file, notes, and all other necessary documents about the treatment procedure, etc., to be completed on time and sent to the medical record sections. Next is to ascertain patient's travel plan. So in this, if necessary, you as a nurse may also assist the patient in his travel or journey after for discharge. Providing emotional support. So you as a nurse must keep in mind that the patient might have a mixed feeling about leaving the hospital and going back to his home environment. And you as a nurse should help the patient to cope up with all this distress or these negative feelings about separating from his newly found friends and staff members. Okay, so emotional support should be given to the patient. So in this video we discussed about the role of a nurse during admission, where we also discussed about the rights of the patients and how to protect the rights of the patients, parole, and also the responsibilities of a nurse after discharge. Thank you.